So the question is why LDP? This is not for all of you, but for AIOS. So why should AIOS conduct LDP? Was the question which was asked. Because it's a lot of, it's expenses, a lot of expenses, and what did AIOS get back? So this is an answer to my president and the other people who are doubting it. So why have I bothered to stay back for this Sunday? After about 8 presentations, various sessions, family is calling, a 5-minute non-scientific jargon here. But I will stay. LDP alumni is my own family, where this process called I shifted to we, and where you invented yourself. It's a long journey for a doctor whenever we start. May have been your school topper, may have studied and worked to reach where you are. And during that process, what has happened is, many may have inner satisfaction, may have money, may have happiness, power, but some people may have a daily chorus of doing this and going at 8 and coming back at 6. But many of us may have become lonely, non-communicative, lost the bigger picture in life, become economic losers, lost the bigger value and meaning of life. We all always look at the people who have actually made it big. But if you look at the Gaussian distribution curve, most of the people have not made big. The art and science of life is indeed lost in the urgency to learn ophthalmology for most people. And AIOS, ARC, LDP may give back just that at the personal level, trying to plug that big hole in the medical education program, but which is essential in life. I asked a group of MBBS students whom I was teaching, how many read the newspaper every day? There were 2 or 3 hands which are raised. When I was a local boy in my state and excelled, my leaders nominated me into LDP, and they said your outlooks and attitude will change. And what are the benefits? We look at it in 4 heads: clinical benefits, personal benefits, benefits to AIOS, and society at large. As far as clinics are concerned, we have stuck up ourselves in a technical perfection. Like, how can I use a Rexis with my left hand or my right hand, ILMPL, how can I do clockwise, counterclockwise, how can I increase my surgical time? We've lost track of patient perception. Whether the patient is interested in finding out whether I do a left-hand Rexis or a right-hand Rexis, which years of experience can bring, LDP gives it on a platter and helps us realize more what the patient perceives. The art of medicine versus science of medicine, both are important. It's 2 sides of the same coin. Need to fulfill both. Younger doctors rely more on science, and older ones increase the art side a little bit. The right mix is taught after LDP. So the personal benefits, as a lot of people said, is to rediscover or reinvent ourselves, to understand what I want, what makes me happy, and predict my own behavior patterns, which otherwise is very unpredictable. Now you have to predict our own behavioral patterns, find out our strengths and weaknesses, and the way we should conduct with patients, staff, subordinates, and superiors. It gives us immense financial insights, which otherwise in medical school, after medical school, you would not go. So as Virender Agarwal said, after years of solo practice, you realize a lot of financial information, which you come to know in LDP, legal knowledge, confidence. It shapes our minds to be more efficient, creative, and innovative. And it has definitely helped me in understanding life that is scientifically structured. Does it benefit AIOS? Yeah, that's a big question. The question may be looming in the minds of decision makers of AIOS. Most of the AIOS decision makers became leaders by their own hard work, not by going to LDP. LDP started here in only 10 years back. Then why AIOS should spend money on LDP? State Ophthalmology Society has leaders, and they pick up the leaders of tomorrow, send them to LDP, and they come back to the state and can contribute to state society better than what we were. We heard Srinivas Joshi talking to us about how he has understood the concept of zonal, how he has understood the concept of moving into the periphery and doing programs, and how LDP has helped him in improving his state society. Overall improvement in state leadership will definitely improve the country as a whole. As Dr. Natarajan said, it is not just the country that we are looking at, it's the whole world that we're looking at. All specialties put together, the specialty called ophthalmology is highly placed in my state. The best academic programs, the best social programs, charity programs, the conferences, giving chances to juniors to come up is basically because of all this. LDP has a huge task force. It's like a well-oiled machinery. If AIOS wants a particular program, we know about the diabetic retinopathy program, or any epidemiological program or what it is. It takes a simple WhatsApp message on the LDP alumni group, because these are all not ordinary ophthalmologists, they are the best of the best in the country. And if AIOS wants to conduct a program all over India, just consider it done, because you have about 150 to 200 LDP alumni who can do it. They are directly answerable to the AIOS. What is in store? Tomorrow, when AIOS should strive to overtake American Academy as the largest destination of world ophthalmology, AIOS will need large number of trained followers, volunteers and leaders. We are already in the right track making them. We have thought ahead of your times to shape our human resources. So better, it's all better. Better at personal level, better readers, I to V transformation, better financial knowledge, better legal knowledge, better communication, better interpersonal relationship, and finally AIOS becomes a more refined society. In my state, getting an LDP nomination has become a status symbol. Benefits is to be extended to more members. For that, it has to be a training of training methods. AIOS should definitely give tasks for the LDP trainees to perform, be it anything. AIOS has to understand the strength of LDP and directly under the AIOS and provides a great task force. To conclude, it's an out-of-the-world program which benefits each and every participant immensely. I need to thank my mentors, all my mentors, including Dr. Ajit Babu, Dr. Natarajan, Dr. Partho Bishwas, who have instilled great confidence in me. Thank you.